Well, good morning, everyone. Once again, welcome to another live this morning. Hope you're having a great start to your day. And we'll wait for a few folks to come on and say hello. We love saying hello to you guys. And here we go. We got a few people coming, and we'll do our little roll call. Jen, good morning to you. Rosalinda from Niagara Falls. The kidneys. Hey, there's a new story about kidneys. Mike from Norland. Kevin, John, Elgin, Illinois. Mary. Anybody from Buffalo that got, 6 feet of snow? Karen, Alan, good morning. Nick, and Norma, good morning. Cease from the Netherlands. Catherine. Springdale, Newfoundland. Bonjour, Chantal. Ottawa. Zienne, Ottawa. Lynn, Werner. Bonjour. Jane, Tirana. And Jeanette, good morning. And Danny, good morning. How are you? Jeanette from our staff. Fran, Orangeville. Linda, the real Linda. Bonjour. Wendy. Markham, good morning. Deb, Timmins, Snowy, Timmins, Ontario. Donna, Bell Valley. Suzanne, good morning. Yolande, bonjour. And Mordecai, good morning. Knoxville, Tennessee. Dave from Windsor. And Dave from Muskoka. Diane, Thunder Bay. Charlotte, good morning. Oh, you like my shirt? Oh, my wife will be happy about that. Dale, Waterloo. Anita, from Florida. Vera, Newfoundland. Julie, good morning. Arlene, good morning. Couple more. Helga. Dave and Helga together. Lori Lee, Ventura, California. Lisa Marie. And Rhonda. And Peter. Rita, good morning. Mary, storming in Nova Scotia. Donna and Lorraine, British Columbia. Star, good morning. From Richmond Hill, Ontario. Linda, very cold in Pennsylvania. New Brunswick. Heather, good morning. Elaine, Maryland. Kelowna, British Columbia. Lori, Cambridge. You guys are wonderful, and we thank you. And thank you very much. Now, let me just brighten this up a little wee bit, see if you like this better. Better? Let me know if you like that better or not. Okay, guys, we're going to talk about hiding in plain sight. Hiding in plain sight. What do I mean by that? Now, I talk to you all the time about B12. It's one of my favorite, I don't know if it's one of my favorite subjects, but it's something you have to understand that for me, my clinical days were days of looking for deficiencies. Very, very common. This was in, I believe, over that, and actually this study confirms it, that B12 is B12 deficiency is much more prevalent today than it used to be, okay? It's much more prevalent today than it used to be. And I want to talk to you about why, and then I'm going to talk to you about some of the symptoms. And you guys know me. I've talked about B12 for so long. Repetition, but it is such an essential vitamin. And the key for B12, the key is the optimization of B12. And I told you that in my dad's day, doctors were not only conscious of B12 and deficiency, they did something about it because it was nothing for doctors in the 1950s, in the early 60s, giving B12 shots. My wife is a nurse, and she gave out more B12 shots than you can shake a stick at. And today, you almost got to be dead before they give you B12. And the reason is, I call it the hijacking of labs. Labs have hijacked medicine in a lot of ways because they have their normal limits. So anything above, what is it, 2 something? My friend, that's enough B12 for mice, not for you. And so people walk around hiding in plain sight, and they don't know they're low in B12. Now, I'm going to tell you, first of all, why that is happening. Why are people so low in B12? Okay? Now, some of these are obvious, but let me just go over them anyways. Why do we see such a deficiency in B12? And remember, if you're in the 200s, the 300s, the 400s, the 500s, the 600s, and even the 700s, you're not, well, in the low 2 to 5, you're literally deficient. And even in 6 and 700s, you're low, you're not optimized. You need to have B12 optimized. Now, I was talking to a fella on the weekend. He's telling me he's tired all the time. Okay? And I'll get into more symptoms in a minute. But right away, I asked him a question. Are you on any medication? Yeah. Well, I can just about assure you that you're low in B12. What? That's what he said to me. What? My doctor didn't tell me that. And I know, because your doctor has been hijacked by the labs. It's within normal limits. But if you understand what B12 does, then you understand you need to optimize B12. Now, any medication, and I mean it, any medication. Do you know that 50% of the population in North America is on medications? And when it gets to the age of 50 and up, now you're talking 80%. And when you're over 65, now you're over 90% of people take medications. People always look at me like I'm crazy. I don't take medication. Now, listen. Okay, listen to what I'm going to say, because this is really important that you understand it. I'm not boasting in that. Listen, if you need medication, I'm not telling you to get off of it. Please don't misunderstand what I'm saying. I am so thankful. Okay? I am so thankful that I don't need any medications. Okay? You know, and I thank God for that. For me. Okay? But I'm an exception. I'm 70 years old. Going to be 71. I'm an exception. I was, you know, you do insurance, you know, and what? You're not taking meds? Nah, thank the Lord, I'm not. Now, let me say this. Any medication you take, any, lowers your vitamin B12. Any medication. The worst ones, and this particular fella that I talked to the other day, he is on metformin. Metformin is the most popular drug for a diabetic or even a pre-diabetic, or even women that have PCOS, polycystic ovarian disorder. Often they're put on metformin to lower their insulin. But that drug, that medication is extremely hard on B12. Extremely hard, but so are the other meds. High blood pressure meds, stomach acid meds. You know, you name the med. They knock your B12 down. Metformin knocks it out. If you're taking any medication for your stomach, any medication, okay, you know what? You're low in B12, almost invariably. I saw in my practice almost no exceptions to that. No exceptions to that. So why do we see today, hidden in plain sight, and people don't know it, because doctors are not trained like they used to be. Anything that's classified as a vitamin, I'm sorry, but they've missed the boat because they're not being taught in medical schools the importance of B12. And the pharmacist is another profession that I want to scream. They should be warning people, because it's well known that if anybody leaves their pharmacy with a prescription, stomach, metformin for diabetes, high blood pressure medication, including diuretics, you know what, my friend? They should be given a warning that they're going to be low in B12. But it doesn't happen. It doesn't happen. And people don't know. Medicine, unfortunately, does not know how to interpret B12. They don't know how to interpret it. And if you're low in B12, you know, you could be anemic. That's the only thing that bothers them. It's a lot more than that, my friend. So one of the reasons that people are so low in B12 today, and why it's so prevalent today, is meds. Okay? Now remember, I am not telling you to stop medication. I'm not doing that. Please put an asterisk beside what I'm saying. This is for information purposes, and I'm just trying to give you what's happening out there. And I'm so adamant. Okay, now, secondly, low stomach acid. Why? Okay, you guys know this too. Why do we see so much low stomach acid today? I'll tell you why. It's our choice of foods. Use it or lose it. Okay? Just like the gallbladder, your stomach is use it or lose it. When people insist your stomach was made to eat steak, sun, steak, and steel. Do you like that? Okay? Your stomach was made to eat steak. That is why your stomach has such a high acidity. Now, the rest of your body isn't acidic, but your stomach is really acidic. Really acidic, or at least it should be. Okay? Your stomach should be very acidic. Okay? Why? Unlike a rabbit, unlike a cow, okay? A cow has 4 stomachs. But the pH in a cow's stomach is much different than a human being's. Did you know that? They don't have the acidity. They don't need it. They regurgitate everything. And they're meant to eat grass. You're meant to eat steak. Okay? So now you get a double whammy. People don't eat enough steak. And they don't get B12 in their food. 2, when you don't use that acidity that God gave you so that you can eat steak, okay? You lose it. So what happens? Your pH in your stomach goes up. It becomes more alkaline. It doesn't get to alkalinity, but it becomes less acidic because you're not eating steak. So what happens? And my friend, let me say something else. Chicken ain't steak. Now you still need acidity to break down chicken, but you don't need the same acidity that you need to break down red meat. Why do you think I'm on a crusade? To get people to use their noggins and start eating steak. There is nothing negative about steak, red meat. Nothing. It's all propaganda. None of it is true. Do you think that God hid B12 in steak and then says, sorry, you can't eat it. It's not good for you? Think about that for a minute. Okay? But when I say you, I'm talking about the world. When the world insists on being carboholics, when the world insists on being vegetarian, when the world insists on being vegans, and they listen to what I'm saying, coming to a theater near you is they want you to be just like them. They want you to be just like them. But you're going to lose your stomach acidity. And so what does your body do? It's amazing what it does. It overcompensates. So what happens? Your proton pumps inside your stomach says, okay, you're not eating enough red meat. Therefore, you're eating too much sugar. You're eating too many carbohydrates. Now, what I'm going to do is you're not making enough acidity. I'm going to make some for you. And your proton pumps that pump out acid. The problem is when those proton pumps start doing overcompensating, you know where that acidity goes? It doesn't stay in your stomach. It starts crawling up your esophagus. And you got acid reflux. And then what do? Oh, you take tum-ta-da-tum-tums or Rolaids or the purple pill to lower your acidity. Now you got a double whammy. You can't even absorb B12. Got it? My friend, why do we see so much of it today? Okay? We see stomach acidity in the wrong place. It's in your esophagus and not in your stomach. And a lot of people, by the way, get acid reflux silent. What's that? Coughing and phlegm in their throat. And they're carboholics. Carboholics have created a huge issue, not only with metabolic syndrome, my friend, but with extremely low levels of B12, and your body will not work properly without B12. Okay? Okay. So we talked about low stomach acidity, obviously low quality foods. People don't realize that. Nutrient-dense foods is the key. But most people don't get those nutrient-dense foods. And I'm sorry, there ain't no B12 in the plant kingdom. It's not in the plant kingdom. Now, some of the B vitamins are there, but not B12. Now, that ought to tell you something. You know, I used to tell people, I rest my case. Now that I told you how important B12 is, what should you be eating? And then I wait for the answer and are you, meat? Yeah. Specifically, red meat. Okay. Okay. And any kind of digestive disorder, you know, like people with Crohn's, people with IBS, people with SIFO or SIBO, small intestine bacterial overgrowth, which is really a fungus overgrowth. You don't absorb B12. You don't absorb B12. And you know what is much more common today? Of course, I never saw it in the 70s. This was non-existent, okay? You have to understand, I've been around a long time. You know what's very common today for B12 deficiency is gastric bypass surgeries. If you know anyone that's had gastric bypass, please, want to do them a favor? Please, tell them to get on B12, sublingual. Make sure they're deficient. Oh, my doctor never said anything. Your doctor's not looking. Most often, you need a functional medicine doctor that's looking at everything holistically. I teach that. If they listen. Linda, that's what I call doctors. Listen, Linda. I got something to tell you. It's very important. Very, very important. Okay, what are the ideal levels of B12? Between 800 and 1200. 800 and 1200. Shoot high. Aim high. Oh, Dr. Martin, I got high B12. Good. That's what we're aiming for. Remember what I've always told you about B12. It's a water-soluble vitamin. The waiting rooms are not full of people in the emergency departments. Oh, I know why you're here. You got high B12. Now, aim high. 800 to 1200 is optimized B12. I want optimized B12 because, again, in practice, I saw the difference when people optimized their B12. They felt better. And sometimes, you know, you get doctors and they don't call you for any reason, okay? You can hardly get a hold of them. But when they call you, your B12 is high. I think I might have told you this story or not, but I had a physician who is a patient of mine. So she's obviously very, very open to, you know, I'm not going to call it necessarily alternative medicine, but, you know, holistic medicine, okay? So she comes in to see me. Then about 2 or 3 weeks later, and by the way, she was extremely low in B12. All the stress and blah, blah, blah. Anyway, she calls me because she had a patient that was one of my patients. And she said, Dr. Martin, I just checked and they have high B12. What should I do? I said, give them a high five. We aim for high. What? I said, Doc, listen to me. B12 is a water-soluble vitamin. You know what that means? Your body, when it doesn't need it, will pee it out. Your body's smart. And so, oh, I forgot, that's water-soluble. Okay? You ain't going to get sick with too much B12. Now, maybe if your numbers are up there, you don't have to take it as a supplement anymore. Just eat your steak. I'd say liver, but I don't like liver. Okay? I don't like it. I know it's good for you. Okay. Okay, now what are we looking for? Signs. We gave you the reasons why people are, and by the way, I didn't give you the other reason. I meant to tell you this. Why are people so low in B12 today? Because cortisol, the stress hormone, it knocks your B12 down. Because B12 is a stress vitamin. It's another reason that people are so low in B12. Stress. You don't sleep. Your stress goes up. Your stress goes up. You don't sleep. B12 is essential. It's an essential vitamin. You need it to make red blood cells. Red blood cells are FedEx trucks on the highways and byways delivering, red blood cells deliver O2, oxygen. Hey, you can't live without that. You need oxygen. I used to tell people, they come in, a lot of women especially, they were like Casper the ghost. I used to use my eyeballs. See these two things up here? God gave us eyeballs to observe. I used to be very observant. People come in, I go, man, Casper the ghost has got more red blood cells than you have. Well, my doctor didn't say. Oh, your doctor is not listening, Linda. Your doctor's not listening. And I'm telling you, you're anemic. You're on that borderline. I don't care what your numbers are. And then I would do their numbers. And I say, see, you're very low. You're very low. You need red blood cells. You need them. And a lot of people, when I used to look at blood, a lot of them had red blood cells in terms of numbers, but they didn't have much oxygen in them. They were like balloons that were never puffed up or never, no air in them. Well, what good are those? The numbers are all right, but they don't have, and you know what fills up a red blood cell? B12. Stress. Menses for ladies. And men can be low in B12, of course, too. Because they're buying the lie about quit eating red meat. Even your brain, think of your brain. Boy, it needs oxygen. Like it needs fat, but it needs oxygen. Vascular, blood cells, red blood cells, hemoglobin. Okay? Yeah, it's really important. Okay, let me give you some of the symptoms that I used to see in the office. Obviously, anemic, okay? And again, I was an observant, really observant. I could tell a person almost a mile away that they were low in B12. Almost a mile away. I got so good at it. My dad taught me that. Look. Look at people. Okay? I had some people Because I'd stare at them. You know, people didn't like that. A lady once told me I was invading her space in my office. I said, you better get used to it, honey. I'm going to be in your space for the next hour. In your face. Okay. I'm a big tease. You guys know me about that. But if you didn't have a sense of humor coming into my office, you were in trouble. Okay? One of my expressions was, are you happy? Yeah. Well, let your face know it. Anyway. Guys, you know me. Okay. Fatigue. Tired. Dragging. Sucking for air. You know when you yawn all the time? What do you think your body's doing? It's sucking for air. You go up a flight of stairs, sucking for air. Red blood cells, they carry O2, oxygen. Think about that for a minute. Fatigue. Tired. Sucking for air. In medicine, we call it shortness of breath. I like sucking for air better. Okay? Depression. It's a factor, I'm telling you, in depression. B12. Your brain don't operate without B12. It'll operate, but it's not going to be at, at its high level that it should be. And depressive people, I always gave my patients that were depressed, and like I said, I tested, but they were low in B12. Always. They were low in vitamin D, and they were low in B12. Seniors, listen. B12. Oh, if I could get into senior homes, I would bring with me the two tools that they need. B12 and vitamin D. All of them. B12 and vitamin D. You've got parents. You've got grandparents. You're older. B12 and vitamin D, my friend. Your brain needs it. And you all know about nerve. Your nerves need it. Because you see, the reason, by the way, I'm getting back to the story I started out with today, talking to someone on the weekend that told me about they were getting nerve pain. Neuralgia. And I said, well, I can guarantee you one thing. You're low in B12. Guarantee it. Nerves need B12. And a lot of people have paresthesia. They have even mouth symptoms. Tongue symptoms. And oftentimes it's low levels of B12. Anemia, Casper the Ghost, fatigue, depression, neuralgia, and diabetic neuropathy. Okay? Diabetic neuropathy. Their numbness of their hands and their feet. And, a lot of people, it's carpal tunnel. Nah. It's B12. It's B12. Okay? And vision. Vision. Your eyeballs need B12. Circulation. You know how I always talk about the highways and byways of your eyeballs? Okay? You look into an eye. I was always amazed. The circulation back there. Highway 407, the 401, the 403, all the highways you can think of in Toronto, you know, they're in behind your eye. Boy, blood supply to the eye. Okay. Guys, anyways, I had to talk to you about B12 again. And it wasn't the first time and it won't be the last time. Probably not. Okay. Okay, we got a great week coming up, guys. We've got some great studies. Kidneys, new study on sleep apnea. I want to bring it to you. Okay? Now, Friday is what? Question and answer Friday. So get your questions in. You can start right now asking questions. I know we get thousands of questions asked. Okay? And we love that. We love you guys. Listen, look, I think what differentiates us at the Martin Clinic, okay? And I know I'm not in practice anymore, but we're online, man. You know, I can hardly understand that. You know, I'm an old-fashioned guy. I told you, I love people. I do. I'm a people guy. But you guys are my friends. You guys are my, you know, I look at my audience and you have no idea how much I appreciate it. And I feel my job is to answer your questions. I want you to think. I want you to, you know, the Bible says, study to show thyself approved unto God. Like, study the Bible. That was me, okay? But what I'm saying is, you do your studying of natural medicine. It's important. Ask your questions. And our job is to give you, our staff are fantastic at feedback. Okay? Anyway, enough preaching. Love you guys dearly, and I mean it. We'll talk to you soon.